another episode of the NLN podcast, Nursing EDge Unscripted. I am the host of today's episode, Dr. Kelly Bryant, and I'm here with my co-host, Dr. Raquel Bertiz, and we're both from the National League for Nursing. In today's episode, which I'm very excited about, we will discuss how interprofessional education programs prepare health professional students for team-based care, strengthens patient safety, and improves care through collaboration. And we're going to be highlighting an exemplar program, IP program at the University of Texas Medical Branch. Before we dive into the full conversation, let's share some of our reflections right after the taping. So Raquel, that was a very informative podcast. I listened to them, and all I could think of is, where was this when I was in nursing school? I wish I could have more opportunities for interprofessional education.
Yeah, I think about my early experiences as a new nurse and having to learn how to relate with all other professionals in the healthcare field and not have had any education on that, like literally, so that I had to learn on my own. So hearing about this program where they actually have required courses in order for them to graduate, that was amazing for me because then it's structured. I mean, structured in the sense that it's not, oh, I can do it, or oh, I don't have to do it, but really learners would have to do all of their IPE activities for their programs. Yeah.
But that just stresses that the university takes IPE seriously. You know, it's not an elective, it's not optional because it's so important and really is needed. If you're going into the healthcare profession, everybody should, having these opportunities to learn from, about, and with other healthcare professionals. That makes the healthcare that we deliver to our patients much better when we can understand everybody's roles. So the fact that the university, made that stance and said this is a requirement, it is amazing in itself. And I think, a lot of times students may, initially participate because it's required, but then they get a taste of IPE. And as Ashley and Katie said, then they fall in love with it and they want more of it because they see the value in it.
Right.
Let's turn from our reflections to the experts driving this important conversation. I am so honored to have our guests here today. We have Dr. Katie Branch, who is the Vice President of Interprofessional Education and the Health Education Center. And we also are joined by Dr. Ashley Parikh, who is the Director of the Office of Interprofessional Education and Practice and Quality Enhancement Plan. So I want to first thank you, both Katie and Ashley, for joining us here today.
Well, thank you so much for having us, Dr. Bryant. This is a wonderful opportunity for us, and we're thrilled to be here.
Oh, it's wonderful. And I have to just start off by saying, I personally had an opportunity to visit your wonderful simulation center, Interprofessional Center. So I was just really impressed by your program. So I'm really excited to share the wonderful things that you're doing at UTMB with the rest of our audience. So let's start off with just tell us a little bit about your program. What makes it unique?
Yeah, sure. Thank you so much, Dr. Bryant. So our program here is a very well established and it's becoming a robust program at UTMB. We have a core curriculum of 7 activities, which are about 2 hours each. And students from all the 5 schools here at UTMB, medicine, nursing, public and population health, Graduate School of Biomedical Sciences, and the School of Health Professions. They all are required to complete 4 out of the 7 prior to graduation.
That's a great program.
I know, I want to say, Ashley and her team does a phenomenal job, and that's just one aspect of the work that they're doing. So we have our core curriculum, and the students do have some flexibility in choosing what meets their interest and what they complete prior to graduation. But on top of those activities, Ashley's team is always doing supplemental things. So we have an annual IPE symposium that is open to anybody at UTMB. It's a great opportunity for faculty, but also students to present their scholarly work in IPE. And we make it free so everybody can attend here in person. And then we also have a scholars program that Ashley runs, and it's open to any students that are interested in kind of going beyond just the core curriculum. And the scholars do have a scholarly project that they have to do as part of that. And then as part of our ongoing quality improvement, Ashley and her team are always piloting new activities. So there's always a wealth of things going on for students to engage in.
So I hear a lot of very interesting things you're doing, and this curriculum sounds wonderful. But I'm also curious. So how do you define interprofessional education in plain language, and what is it not?
Do you want to take that one, Ashley?
Yeah, I would love to. And that's a great question, Raquel. I'm glad you asked that. It's a very common question. I would say IPE, the goal is to improve patient care outcomes and also safety outcomes. It's really when two or more different professions are learning about each other's roles and responsibilities. So a lot of communication has to occur there as they educate each other about what they do and how they can contribute to the overall goal and the team. What IPE is not is when team members of the same profession are working together. So really, as I mentioned before, IPE has to have at least two different professions.
And I'm glad you clarified that, because some people think they're doing IPE and they're not. They think if you just take a group of students from different professions and put them in a room together, that's IPE. But I remember hearing, and I'll never forget it, it's about learning from each other, with each other, and about each other. I always keep that in mind when I think about IPE.
You know, one of the things that I love to see when our students come in, at any given time, we have about 3,000 students that are in the process of completing the core curriculum. And when they come to the IPE events, there's this level of excitement that you see in our learners. And I think part of it is exactly that, is that their opportunity to not only share their scope of practice for their profession, but it's also their opportunity to learn about the scope of practice of other healthcare professionals that they know they're going to be working with in the clinical realm that isn't always included because our curriculums are so packed for our academic disciplines. But this is, an open opportunity for them to learn about other disciplines in a safe environment that isn't tied to a grade for a course, which is, it's fun to see. It really is.
Mhm. So, like I said, I had the pleasure of visiting your campus and hearing more about some of your programs, and they were very interesting. So, can you tell us a little bit more about some of them? I remember there's one that was called, and I don't want to say it wrong, Bafa. Was that how you pronounce it?
Yeah.
Engage me. What's wrong with Warren? So, can you tell us a little bit about some of those very innovative and creative activities that students have a choice of taking or participating in?
Sure. Yes, no, you said it correctly. So it's, yeah, it sounds funny, but Fabafa is actually one of our most popular ones. It's an immersive mock cultural simulation activity, and it's all done in person. And Bafa is the language, one of the mock languages there that we speak. And and we also have What's Wrong with Warren, which is a large-scale case study. It follows a patient with meningitis throughout their IPE journey being cared for by an IPE team. And then Engage Me is where students get another popular one. They get a chance to interact with the patients or the caregiver on various health topics. So they really enjoy asking questions, learning more about, yes, the clinical aspect is great with the panelists that are there, but then, learning about the things they don't get to always learn from a textbook or a PowerPoint, how do the patients and the families deal with this after discharge, especially if it's a chronic disease? What other resources are there? So those are the three that are really our main ones. And then we, of course, Team Steps is our foundational one. Disaster Days, our mass casualty incident there. It's collaboration of the Galveston community partners, as well as the UTMB students and healthcare providers. Our bench to bedside, it's where students get to design scientific experiments on a specific disease and IPE teams to improve patient outcomes. And then we have the extension of Engage Me, which Katie, if you want to talk a little bit more about, our GTEx gems.
Yeah, so we just finished our first year of our Greater Texas Gulf Coast Engage Me series, which is what we do call GTEx Gems for short. And it was building on that Engage Me experience where with Engage Me, like Ashley said, the students actually interact with patients and their caregivers on a specific disease step. What we do with GTEx Gems is we bring it to a larger audience. So we bring in an expert from the state to talk about what's happening at the governmental level, either legislation or funding. We bring in somebody from the region to talk about how that funding is being utilized. And then we also take it as an opportunity to engage students with what's happening here on campus from a clinical or research perspective on that same topic. And those events run monthly for our students, and they're open to a larger audience. So it's not just students, but we open it up to faculty, clinical practitioners throughout the healthcare system here. And then we also open it up to community members. And I think that's one thing that is really vital to IPE, that, we don't work in a vacuum, but it's not only the healthcare practitioners that we work with, it's our patients, it's their caregivers and family, but there's a community involvement also a lot of times in the work that we're trying to do for the good of our patients.
That's a great point, because most of us think it's just for the learners or the students enrolled in that university. So it's great that you open it up to the community and people outside of the university.
Yeah.
Great. It's really wonderful to hear all of the significant events that's happening in your program. And we all know that this is important as we train the future health professionals. So I'm curious too, how do you measure impact? Like what tools and other measurement are important to you?
Yes. I mean, I can start with this one and maybe then Ashley can build on it also, but the research side and the data collection for us is super exciting. I think that's where we see opportunity for improvement and innovation. So we're constantly collecting data on our existing core curriculum. We utilize a modified CAS tool for all of our events. So we're measuring pre and post all of our core activities. And then we do the same for all of our pilot activities. So we like to keep things fresh. One of our activities is what's wrong with Warren. If you do this over and over, it doesn't take very long for one student to talk to another student. And the students come in and they already know what's wrong with Warren and have, that element of surprise or coming up with ideas on your own can be eliminated. So we're always looking for ways to keep things new, look for innovative ideas. And so anytime we have any activities that are suggested by students, suggested by faculty, suggested by our IPE team, we really do try and make them come to fruition. And then once we have those implemented, we're measuring them. And the way that our IPE team is guided is we have an advisory committee, and we meet regularly and we present this data to the advisory committee. So we had an IPE pilot activity on psychological safety. I'm not going to have the name of it exactly right, but Ashley can tell you about that. That we actually piloted earlier this year, but we're collecting data on that to see if it's something that is well received by learners and something that we would want to implement in the future. But I'm sure Ashley can build on further.
Sure, thank you. It was called the Building Trust exercise. It was one of our liaisons, actually, they're big IPE champions from the Graduate School of Biomedical Sciences. And, they learned a lot about IPE and all the different settings. And they realized psychological safety is the core, is a very important aspect to have on an IPE team. regardless of any setting. So yes, the pilot was led by students under the faculty supervision, and they were very engaged. Students from all over, from different programs and schools at UTMB came together and talked about what is psychological safety. How do we incorporate that with IPE to improve patient safety in outcomes? And it was very successful. The conversations are the most favorite things that students love. And from our post-survey assessments, especially, they say that one thing they enjoyed the most was being able to, when we forced them to sit with students from different programs and just communicate about each other's roles and responsibilities. So now we make sure we force them to continue to do that, or encourage them to do that, I should say, at the beginning of each of our activities. So the data really has been helpful.
Yes, we
the
know
one
that
thing, oh, sorry, go ahead.
No, okay. I was just going to say, we know the students love IPE. They love to get together with other students from different disciplines and learn from each other. I'm sure that you found that on your evaluations, and they tend to want more of these type of activities. They don't know how much planning and resources go behind it.
Yeah.
And Katie, I didn't mean to cut you off.
No, I was just going to say one of the aspects that I think has made our IPE core curriculum so successful here is that we have buy-in from senior leadership. And this data that Ashley and her team are collecting on a regular basis helps inform the work we do towards IPE. And the institution has decided the last 2 cycles for our institutional accreditation, our quality enhancement plan focus has been on IPE. So our data all goes to meet those quality expectations as part of our quality enhancement plan across the entire institution. So we value it, but not only do we know the value of it, our senior leadership knows the value of it in terms of what we're trying to do in our mission at the institution. So the data is well utilized.
And it helps a lot when you have your senior leadership that believes in these programs and supports these programs. So we know it's great, it's wonderful. You have the metrics. Now let's switch gears and talk about the challenges, because there are so many, educators that would love to take on an IPE program, but they face so many barriers and obstacles. So what do you find are the biggest challenges with implementing a program such as the one that you have? Because you always hear scheduling. I'm guessing that's probably the top barrier.
Go ahead, Ashley. I know you can speak to this one.
Yes. Yes, and scheduling is one of our biggest challenges. I will say, when the program did start, there were the programs, all the 5 schools decided that there was just 1 week in every month, like the 3rd week, where all the activities, all IP activities could be scheduled. And so it was a lot for staff to schedule, as you said, so much that my team does behind the scenes. And so then COVID hit. Well, with COVID, a lot of programs went online or hybrid, and new programs came about as well. So I will say that we listened to the data and evaluations, and we decided to have at least now 1 to 2 activities a week in the mornings, afternoons, and they really appreciated that. So it's worked out well.
Yeah, it's interesting to hear all of these challenges that we have to navigate, even if we all know how important IPE is and should be, not only in nursing education, but all of health professions. So if, for example, if we're helping our health professions community try to advocate for inclusion of IPEs as a foundational competency, right? So what would that one strong argument do you think that we should be using to say, hey, IPE is foundational competency, it needs to be included in the curriculum?
For this one, what I would say is we're stronger together as a team, not only in healthcare, but in IPE. There is no reason that one school or academic program needs to do this alone. reach out, find your champions across the institution, and together collectively, you will move that mission forward so much faster and stronger than if it's one school, one faculty, one department at a time. So use your resources, networking, and teamwork.
Which embodies the very collaboration that IPE should have.
Exactly.
And do you have any, as we're running out of time, because we can talk about this for hours and hours.
Yes.
For someone who's just starting out, you gave a great tip, but are there other resources that you would refer people to if they're interested in implementing an effective IPE program? Where should they go?
Go ahead, Ashley.
I can start off and really say the biggest thing when I came into this role was collaboration, really finding a network of IPE champions, and really trying to have the conversations. I met face to face with a lot of them, and it took a little time, but I really had to put myself out there and let them know that, hey, we can, I think we do have some shared values, and let's see how it can align with your goals, your program, and UTMB's vision. So yeah, just having those conversations about collaboration first off really helps.
I would say, to build on that, look at your local, your regional, your state, and your national organizations like the National League for Nursing, and the International National Interprofessional Education Organizations. There's a ton of resources out there that you don't have to start from scratch. Build on what other people have already set the building blocks for. The only other thing that I can think of that would help institutions that are just starting off or are trying to make the work that they do in IPE have an impact is the difference that I see here at UTMB compared to some other institutions is that UTMB has made the core IPE curriculum a requirement. Like we mentioned, all the work that goes behind organizing and scheduling and getting things to be just right. Nothing is more defeating is when nobody shows up.
Mm-hmm.
You have one or two people. So our events that we hold, there are some What's Wrong with Warren, BFA, we'll see up towards 200 people show up per event because they are required. And it isn't a big lift for students here. It's, as Ashley mentioned, 2.5 hours per activity. And they have the whole course of their academic curriculum to finish that work. Mm-hmm. So 2.5 hours per semester isn't a lot to ask, but then it does show the value to the students that we do value this as an institution, and then it does pay off in the long run. We do all this work knowing we're going to have a large volume of actual learners show up to participate.
Mm-hmm. Yeah, and I think it's just beneficial. Yes, it's 2.5 hours a semester, but think of what they learn and the opportunity to work with others outside of their profession, because we all go to school in silos, whether you're a nurse, a dentist, physician, OT, PT, and then we're expected to work together in a clinical setting. And then they wonder why, sometimes we struggle with communication and collaboration because we've been apart and we don't know what each other, does. So we are unfortunately out of time. So I want to thank you both, Katie and Ashley, for joining us for this episode of the Nursing EDge Unscripted, brought to you by the National League for Nursing. So a special thank you again. Thank you for taking time out of your busy schedule and sharing the wonderful work that you're doing at UTMB.
Feel free to reach out to us also. Ashley, her team, our organization, if we don't have the answer, we have a large network and we're willing to collaborate, work together on either if it's implementing a IPE program or if there's opportunities to collaborate on IPE events or even research and innovation, we would be happy to do that.
Yes.
Thank you for offering that. So we appreciate your support and look forward to those of you in the audience joining us for our next episode. Thank you.
Thank you for having us. It was a pleasure to be here today.
Yes, and thank you so much.